Welcome everyone to our 2018 Blue Cross and Blue Shield of Illinois Small Group Update. My name is Josh Graham and I am the Sales Manager for our group department here with Flex. And today we're going to be going through all the changes that Blue Cross has in store for us for 2018, focusing really on the most important ones and what's going to allow you to get ready to sell immediately. Before I begin, the one thing I must mention in this disclaimer is that the presentation is intended solely for the use of producers appointed to sell Blue Cross and Blue Shield small group products through the Flex General Agency. And this presentation and the information contained within is being shared for informational purposes only and is current as of October of 2017. It is subject to change based on subsequent federal and state laws, regulations, and guidance, and it does not constitute legal, compliance, or tax advice. Now that we got that out of the way, let's get moving right away. Pharmacy benefit changes for 2018, focusing in the small group market segment, which Illinois defines as 1 to 50 average total number of employees. Major differences between 2017 and 2018. With 17, only in-network deductible and out-of-pocket were sent to Prime Therapeutics, which is their pharmacy benefit manager. All pharmacy claims applied to the in-network accumulators. A major change for 2018, which does not impact the HMO, is that your out-of-network pharmacy claims are going to apply to the out-of-network deductible, if that is applicable. Out-of-network coinsurance and copays will only apply to the out-of-network out-of-pocket, and any additional charges for using an out-of-network pharmacy will not apply to the out-of-pocket amounts. It is very important to stay within the network, and we'll go through some of those details here in a minute, just focusing on the fact that there is going to be an out-of-network benefit for deductibles and out-of-pockets that will accumulate separately from your in-network deductibles and out-of-pocket. For the annual drug list review, this is something that we're going to need to continue to take a look at. All carriers are doing their best to control premiums, but every year Blue Cross and Blue Shield will look at their drug list and they will determine how they're going to control costs for the year, how they're going to make the experience better for users. Part of this review is the addition of drugs to their drug list, potentially moving drugs around into different payment tiers, possibly not even allowing certain medications to be covered, where members may be encouraged to try generic or brand name alternatives. Really, it's important that members are their own advocate through this process and that they speak with their own doctors about therapeutic alternatives. Sometimes it's not eligible, but there will be a closed formulary for 2018 like there was last year, and if your drug is not part of that list, it will not be covered. So it's important to focus on that. Included in the utilization management programs, those are certain drugs that may require prior authorization or step therapy, potentially dispensing limits that they may not have had in years past. So it is important to take a look at that drug list. The one thing I would point out to everyone is that the drug lists change quarterly. So while you may write a group for January 1st, by the end of the year, some of those drugs may be covered differently than they are today. So it's really important that you convey that message to your clients. This is going to be something that will continue to evolve and change, and it's important to understand that this is a challenge for everyone, and it's one of the largest factors of our increasing premiums. It'll continue to rise, and we'll see how things play out through the rest of this year and into the next coming years. Many of you may have received a letter from your client panicked about their policy no longer being renewed in 2018. And part of that, if not all of that, was due to this major change. The drug plans that are going to be offered in the small group market segment are moving to a 6-tier benefit design. And because of that change, it required that the plan names and IDs were also updated. And when that sort of thing happens, it does require that the carrier provide notice to anyone enrolled on those policies. So that's the letter that came out to your clients. So effective January 1st, 2018, or with any groups renewing in 2018, a new 6-tier benefit will be part of their prescription drug offering. And basically what they've done is, many of you are probably familiar, you always had a generic coverage, brand name coverage, and a specialty coverage. Well, they've basically broken that up into 2 tiers each. So you'll have a preferred and non-preferred generic coverage, you'll have a preferred and non-preferred brand name coverage, and a preferred and non-preferred specialty coverage. And really this helps control some of those more expensive medications, moving them into some of those higher tiers to help control the overall cost. If you're taking a prescription that is in the thousands and thousands of dollars, it makes sense that you should have a little bit more skin in the game to help control the overall premium costs. So this was the major change on the pharmacy side that was introduced for 2018, and why many of your clients receive those letters of their plan no longer being available for the 2018 plan year. So focusing on the actual product updates, more so on the benefits outside of pharmacy, we'll take a look at one of the new changes for 2017 to 18 with the ACA mandate. Basically, there is an enhancement of the ologist rule, and what many of you may not be familiar with, prior to 2018, there was a rule that was passed that if you were in a particular in-network facility and you had the anesthesiologist that was working with you in a particular situation that was out of network, which you had no choice of actually going to them or not, that had to be treated as an in-network physician. And that is basically being expanded upon in 2018 to also include physicians that are part of the emergency room that you visited. Obviously, they're only going to be in network in those emergency situations. Assistant surgeons, if there was a primary surgeon under the PPO that you were visiting that you have no control over, and other hospital-based physicians. So this is really protecting the members from experiencing any out-of-network claims when they shouldn't be. To give you an idea how it affects it in different states, I'm really just going to focus here on Illinois, but focusing on the three major products that they have. So the first one being your PPO. The ologist rule is going to apply for really all three products. The provider is going to be reimbursed at a billed charge, and the member cost sharing is going to be applied to the in-network out-of-pockets. For tiered PPOs, very similar. It is going to apply. It will be a billed charge, and it'll apply to the in-network out-of-pockets. And then your HMO, a little bit different. It still applies, but the risk is actually on the IPA, so they're responsible to pay that, and it's going to be reimbursed at the medical group rate. So no real changes there for the HMO products. So focusing on the major revisions that came into play for 2018, we just talked about the 6-tier pharmacy structure that really triggered that discontinuance and replaced the existing 2017 portfolio. But other adjustments were made for copays, deductibles, and out-of-pockets. They were really done in order to meet the new actuarial value compliance. As you make changes, there's every year, as you're aware, some out-of-pockets are increased. And being able to fit within those actuarial values is important because that's the only way that the carrier can offer that product in the state. And so there were some changes on all the plan designs that we'll look at here in a few minutes in regards to their copays, deductibles, and out-of-pockets. They also help simplify the overall product portfolio by defining some guiding principles for plan design consistency. Many of you may be familiar with some of their deductibles that were 2 times or 3 times or 2.5 times in years past. Obviously, that got a little bit confusing. So now in the small group 1 to 50 market segment, for any plans that are offered, you will have a 3 times for family deductible and out-of-pocket. Makes things a lot easier. As well as there were some changes to the HSA mins and maxes based on the new mandates that we'll go through in just a minute. There were new plan designs added, 2 HMO plan designs, and there were also 5 plans that were modified to basically leverage how CMS has expanded their actuarial value for 2018, meaning prior to 2018, once you took into consideration the actual benefits, you had to be within plus or minus 2% of the metallic level. That's expanded on for 2018. Some plans are being discontinued, and the major reason for the discontinuance was due to plans that had little to no membership that may not have met the new actuarial value for 2018, which is going to encompass about 9 PPO plans, 4 HMOs. There was also, some of you may be familiar with the all copay plans that were offered on the PPO network, basically giving you a high out-of-pocket maximum but covering most basic services at a copay level. Not a lot of traction with that plan. That will be discontinued. And really all of 2018 small group plans are going to be offered off exchange. So if any of you had the privilege of working with the SHOP program, Blue Cross is no longer going to be entertaining those on exchange products for 2018. Looking at your preferred versus non-preferred pharmacy, basically you'll see there are differences in those different categories. For any coverage that's 100% after deductible, that would be more common for an HSA qualified plan. You'll have the same preferred and non-preferred coverage. For other programs, which will be more of your traditional PPO type plans, you're going to have the 6-tier drug card that will include $0 for your generics versus non-preferred, which is $10. and so on and so forth. So you can see some of the increased costs that we passed on to the member should they choose not to use a preferred network pharmacy. And to give you an idea of what those pharmacies are in 2018, Walgreens, which you can find on almost every corner, will be in their preferred network. Walmart and Sam's Club as well. Albertsons, if you have those near you. And then there's also Access Health, which is a group of independent pharmacies. It is important to note that CVS Pharmacy is still going to be considered out of network. The only exception for that is with the Illinois HMO plan. Those are typically for groups with over 150 enrolled employees. CVS will continue to be participating in that particular pharmacy network. Talking about HSAs, this is something that comes up very often as we're talking to producers, and the concept of having an embedded HSA. And for the purposes of this discussion, you really have an embedded aggregate HSA, which is the best of both worlds for a member. What that means is once an individual has met their deductible or out-of-pocket, the benefits will begin. Meaning your coinsurance will pay at 100% or 80%, just depending on the plan design. That would be the percentage that the carrier would pay. The member would pay the difference at that point. Now, the difference on a family side is where you really get the benefit. Family limit, when met, the benefits will apply to not only the people that met the family limit, but also anyone else that's covered under that particular family. So there is a worst case scenario for your family. If you hit it, everyone's covered for the rest of that calendar year. Embedded plans have both individual limits that one person on the plan can meet and be covered, but they cannot exceed prior to receiving the benefits, as well as the family limit. So really, each person in your family is going to be protected by their own individual deductible or out-of-pocket, and your family as a whole will be protected by that deductible and out-of-pocket. Whichever one comes first will be used. Once the family limit on all of the members is hit, then everyone is going to be eligible for those benefits. So pretty basic in today's products and how they're being offered, but because we have so many questions on it, we thought it was important to include within this presentation. So some of the changes with your HSA guidelines from 2017 to 18 can be seen here. For your HSA embedded, the minimum deductibles are going to be increased. So you were familiar with in 2017, the $2,600 minimum deductible for self-only times 2 for family. That is going to go up to $2,700 in 2018, or times 2 for family. That'll be reflected in your particular plan designs you'll see for Blue Cross. For the HSA embedded out-of-pocket maximums, for 2017, that was at $6,550. That'll be going up $100 for individuals and up $200 for your families. And then non-HSA, so any of your PPO style products, the out-of-pocket maximums for 2017 have gone from $7,150 to $7,350. Now, not all plan designs will have these particular deductibles and out-of-pockets. However, these are the maxes and what the carriers are required to comply with moving into 2018. Taking a look at some of the discontinued plans that we had mentioned previously, there was a Platinum PPO, the P502 PPO. That'll be going away. I'm not going to run through all of these because you will have the ability to go to the Flex website and download the plan grids that identify all the new plans that are being offered. But just knowing that there were some plans that were discontinued for the reasons I mentioned earlier. Blue Cross has provided some mapping suggestions. Most of this is going to be done automatically within your renewal packets that you will receive for your groups. Ultimately, for those plans that were removed, the P502 PPO is an example. For the first one, is being mapped to a gold plan that'll have similar characteristics, but definitely going to have some differentials in how those benefits are covered. So this screenshot will give you a snapshot of what is being moved from 2017 into that 2018 plan year. Some of the new plan designs that are being offered, there's going to be a new HMO, as I mentioned, the B533 PSN. PSN stands for Blue Precision HMO. Blue Care Direct is also still going to be available. That is the advocate-only network for HMO. And then there were some additional plans that were being added due to the actuarial value range being expanded upon. And that's going to be your S534 PPO, and then also the S534 BCE, which is your Blue Choice Preferred. Now, one thing that I really liked, which I believe is going to help simplify how we do business in 2018, are these twin plan IDs. Basically meaning the benefits are very similar whether you're in the full PPO network or a smaller network, but they're using the same plan IDs. So for example, in 2017, the top plan, there was the S500 PPO. The same plan design for that particular benefit was called S528 BCE, BCE indicating the actual network difference. But the plans were very similar. So for 2018, the decision was made to keep those numbers the same, just change the network indicator at the end of that particular plan ID. So in 2018, the S534 PPO is going to be the same as the S534 BCE. The only difference for you will be the difference in the network, the full PPO network versus your Blue Choice Preferred. Get out your magnifying glass, 2018. Here is a nice description showing the 2017 plan code versus the 2018 plan code. And anything that you see highlighted in gray was a change from the prior year to this year. That should be noted. So as you're looking at your renewals this year or any new business cases, definitely have these graphs handy so that you can identify any differences from the year prior. I find that very helpful, especially when you're wondering, you know, why did my rate go up, or why was this rate up not as drastic? Some of these indicators could identify why that was the case. I'm not going to run through everything on this screen just because, you know, it'll take us all day. However, for these different products that are being offered, it's going to be pretty much business as usual. As you are going to see, and I mentioned, some of the deductibles for your individual versus your family are going to be 3 times. And that's important to note. Contact your sales rep here at Flex because we do have the plan grids available that you're able to use to help with navigating some of the quotes that are currently being sent out to you. So this just gives you an indicator of how plans got mapped from 17 to 18 and some of the differences that are available. Now, one of the things that I wanted to mention, many of you are probably familiar with it by now, but it comes up quite often for newer agents coming into the market when we're asked, you know, what is a per occurrence deductible? And you'll see these listed in the column towards the middle of the page, but a per occurrence deductible helps control cost, the premiums associated with these certain services. So you'll have a per occurrence deductible on most plans when associating it with an emergency room visit, any inpatient hospitalization, or an outpatient surgery. And basically, whenever you have one of those services rendered, you will have what seems like a copay, but it's technically called a per occurrence deductible that you would pay for that service. That per occurrence deductible would accumulate towards your maximum out of pocket, so you are getting credit for it. But what happens is you owe that amount first, and then you go to the actual plan deductible. And once you've met the plan deductible, then the coinsurance kicks in. So it's important to understand how that works because when people see these dollar amounts, they think, okay, if I go to the emergency room, for example, on that G511 BCE, the emergency room copay is $400. But in reality, it's a $400 per occurrence deductible and then a $1,250 plan deductible followed by the coinsurance amount at 80%, member responsibility being 20%. So that's a big difference between paying $400 for an ER visit versus the actual cost that it will be. So it's important to understand how that works. It really helps the plan stay competitive from a pricing perspective, and it's not going to be something that people will deal with on a day in, day out basis, but that's something that comes up quite often and is very commonly not understood by agents. Taking a look at some of the Blue Options plans, these are probably the best product, in my opinion, that are offered in the market right now, and they're very unique in scope. And what you're going to notice is you're going to have different deductibles and out-of-pockets based upon the network that is being utilized. So for these options plans, you have the ability to go within the full PPO network, or you can go into the slim down network. And that slim down network is going to be considered your tier 1 benefit. And with that tier 1 benefit, you're going to have lower deductibles, you're going to have better coinsurance, you're going to have lower co-payments, and it's really going to help control the cost. But historically, whenever we've sold smaller networks, there was always the what if concern. What if I needed to go to this hospital or that hospital? And these products really help eliminate that what if because you still have access to the full PPO network. You could purchase one of these policies and only go to the PPO network if you wanted. But the bottom line is, whichever network that you are going to be utilizing, the benefits within that network will be different. So if I stay in the smaller network, I get a richer benefit. If I go in the PPO network, I have a little bit more exposure on my end as a member. However, I have the ability to determine what is the best network for me. So these are very interesting products, and why we find them so competitive right now is based on that rate. They are priced really, really well. They still allow you to go to that full PPO network, but for those that actually utilize the smaller networks, it's a great benefit because you can go down to like a $700 deductible. You have $20 copays, a regular prescription drug card. It's a very, very popular plan. For Blue Precision HMO, not a ton of changes. You can see that the new plan in the very middle row there was added, that G533 PSN. It's a $4,000 deductible, 80% coinsurance with your basic co-payments for your primary care or specialist visits. The Blue Precision HMO product is one of the most competitive products in the market. It is important that you know that it is an HMO, so it does require that you designate a primary care physician. That PCP must refer you out to any specialist within the network, and you got to live with those rules. And if you can, these can be some of the most competitively priced products based on the benefit that you're going to receive. Typically, you're going to have, if you go within one of the platinum plans, you have no deductible, you have extremely low co-payments, and a really rich drug card. So it's an extremely rich plan if you can comply with the regulations within that HMO style product. If you're going to be someone that really wants the freedom to go within any PPO network, or any doctor, I should say, then you're not going to be wanting to enroll in this type of product. But for many people, this is a phenomenal way to control costs and really limit your out-of-pocket exposure throughout that year. Blue Care Direct, very similar. Blue Care Direct products are strictly for the advocate facilities in the Chicagoland area. It still does require that you designate a primary care physician. The nice thing about the advocate product is that they have a lot of take care clinics at the different Walgreens, so you can get seen right away. They can write you a prescription, and then you can be off on your way. So really good product, priced well, and will continue to be offered in 2018 by Blue Cross. So last comments I will provide to you for this particular training will be in regard to forms that are going to be available for 2018. Please feel free to visit our website at flexiblebenefit.com. You can click on the link for producers, and there's a ton of resources we have available for you. All the new plan designs and the forms will be housed on that webpage for you to start with your prospecting. It's going to be important that as we work together into 2018, we do our best with submitting clean cases, utilizing our producer pad website for quoting. That'll give you some streamlined proposals. And ultimately, we appreciate your business and really look forward to working through this very busy time. And with this open enrollment ahead of us, I wish you luck. And please contact your sales reps with any questions so that we can support your growth as an agent within our market. Thank you.